Colleagues, at this time, we'll start the decisions for Health and Human Services. And at this moment, we'll bring up Ms. Naomi Kamara.
Thank you, Chair. My name is Naomi Camaro. I'm a budget analyst with the Department of Legislative Services. We're going to be going through the decision document. I just want to note that items that are being heard by the full committee related to the BRFA are not included in this document. So we'll get started with Natalie on page 1.
Good afternoon. On page 1, for the Office of the Deaf and Hard of Hearing, DLS has 2 recommendations. The first one is to increase the turnover expectancy for 2 new positions from 0% to 25% to be consistent with the budgeted turnover for new positions. That involves a reduction of $39,000 in general funds. The agency disagrees and indicated that recruitment efforts will begin immediately upon passage of the budget bill.
Mr. Chair, I'll move to reject number 1 and adopt number 2.
There's been a motion to reject number 1 on page 1 and adopt number 2 on page 1. All those in favor? Motion approved.
Page 3, for the Department of Disabilities, DLS recommends adopt committee narrative requesting a report providing an analysis of the Universal Services Trust Fund expenditures, and the agency concurs.
There's been a motion and a second to adopt item number 1 on page 3. All those in favor? Motion approved.
We have an additional request on the blue pages. For the Maryland Department of Disabilities, requesting an update of Maryland Department of Disabilities efforts to fill the vacant positions for the 2 positions that have been vacant for less than 9 months.
Move to adopt that narrative.
There's been a motion and a second to adopt page 1 blue sheet. All those in favor? Motion approved.
Page 4 on the white packet. We have the Executive Department, boards, commissions, and offices. DLS recommends adopting a committee narrative for a report on agency minority business enterprise, participation, attainment, and liaison surveys. The agency concurs.
Move to adopt.
There's a motion and a second to adopt item number 1 on page 4. All those in favor? Motion approved.
Okay, page 9 on the white packet, Military Department. Okay. Sorry.
You can go ahead.
Okay, I'm sorry about that. DLS recommends adopting a committee narrative for a report on TRICARE Premium Reimbursement Program participation and implementation. Agency concurs.
Move to adopt.
There's been a motion and a second to adopt item number 1 on page 9. All those in favor? Motion approved.
There is also an additional item for Military Department in the blue pages. Page number 4. DLS recommends a committee narrative for a report on the staffing requirements and long-term staffing plan for the Free State Challenge Academy.
Move to adopt.
There's been a
Just do it with the agency comment. This is.
It's the additional item.
additional narrative
Oh.
to follow the issue. Yeah. There's been a motion and a second to adopt color page number 4, dealing with the Military Department. All those in favor? Motion approved.
On page 5 in the white packet, the Secretary of State concurs with the governor's allowance.
Motion and a second to adopt item number 1, page 5. All those in favor? Motion approved.
And there's an additional item on page 2 in the blue packet where the Secretary of State is required to submit a report on the 2 vacant positions by August of 2024, and the Secretary of State plans to have those positions filled by the end of fiscal 2024.
It's been a motion and a second to adopt color page 2. All those in favor? Motion approved.
On page 8, for the Maryland Commission on Civil Rights, DLS recommends to include in its annual managing for results performance measures related to the unassigned cases categorized by type, the number of present and open and pending cases, and the count of cases exceeding 1 year categorized by type. The agency didn't provide a response.
There's been a motion and a second to adopt item number 1, page 8. All those in favor? Motion approved.
Turning back to page 7 in the white packet, page 6. For the Department of Aging, DLS recommends adopting committee narrative, requesting a report on senior care funding adequacy. The agency concurred.
There's been a motion and a second to adopt item number 1, page 6. All those in favor? Opposed? Motion approved.
And then on page 7, DLS recommended committee narrative requesting an update on the Longevity Ready Maryland initiative, and the agency concurred.
There's been a motion to adopt item number 2, page 7. All those in favor? Opposed? Motion approved.
There's also an additional item in the blue packet on page 3 related to the Department of Aging, requesting a report on Prince George's County Local Area Agency on Aging operations and spending.
Adopt color page, blue color page.
It's been a motion and a second to adopt blue color page number 3. All those in favor? Opposed? Motion approved.
Page 11, please. For the state archives, the recommendation is to concur with the governor's allowance. The agency concurs.
There's been a motion and a second to adopt item number 1, page 11. All those in favor? Opposed? Motion approved.
On page 10 of the white packet, DLS recommends concurring with the governor's allowance for the Maryland Institute of Emergency Medical Services Systems, and the agency concurred.
It's been a motion to adopt and a second, item number 1, page 10. All those in favor? Opposed? Motion approved.
There's an additional item for consideration related to MIMS to adopt committee narrative, requesting an update on long-term vacancies in the agency. Page 5 of the blue packet.
Move to adopt color page 5.
There's been a motion. There's been a second to adopt blue color page number 5. All those in favor? Opposed? Motion approved.
On page 12 for the Maryland Health Benefit Exchange, DLS recommends to adopt a narrative requesting a report on the reinsurance program cost and forecast, and the agency concurred.
There's been a motion and a second to adopt item number 1, page 12. All those in favor? Opposed? Motion approved.
On page 13 for the West North Avenue Development Authority, DLS have recommended restricting $2.5 million of funding for grants to non-governmental entities until the agency submits a comprehensive neighborhood revitalization plan and grants manual. And after we wrote the budget analysis, the agency did submit its comprehensive plan. So if the committee would like to adopt this recommendation, you may want to restrict funds pending the submission of the grants manual. And the agency disagrees with this recommendation.
Senator Zucker.
Yeah, I would move to adopt, but I would just like to suggest modifying the restriction at 250.
It's been a motion and a second to modify item number 1, page 13, instead of 2.5 million to 250,000. All those in favor? Opposed? Motion approved.
On page 14, also for the West North Avenue Development Authority, the fiscal 2025 allowance includes a $5 million increase in funding for grants to non-governmental entities, and DLS recommends reducing that funding by $2.5 million. The agency disagrees with this recommendation.
I move to concur with the agency, reject the recommendation.
There's been a motion and a second to reject item number 2, page 14. All those in favor? Opposed? Motion approved.
Looking at the State Department of Assessments and Taxation on page 15. The first item restricts $50,000 for the purpose of administration pending report on the status of staffing in the real property evaluation program. And the agency concurred in part, requesting the removal of the requirement that the agency research and report on average and median salaries for comparable positions in surrounding states.
There's been a motion and a second to adopt item number 1, page 15. All those in favor? Opposed? Motion approved.
The second item on page 16, still for State Department of Assessments and Taxation, restricts 500,000 or 50,000 for administration pending a report on cybersecurity needs at SSAT and on the status of the Cloud Revenue Integrated System or CRIS development project, and the agency concurred.
It's been a motion to adopt and a second for item number 2, page 16. All those in favor? Opposed? Motion approved.
There's an additional item in the blue packet on page 6 for State Department of Assessments and Taxation. This restricts 500,000 pending a report due July 1st of this year on the recent property assessment notice mailing error.
Move to adopt color page 6.
There's been a motion and a second to adopt blue color page 6. All those in favor? Opposed? Motion approved.
And looking at page 18 of the white packet, Property Tax Assessment Appeals Board, the recommendation is to concur with the governor's allowance, and the agency concurred.
There's been a motion and a second to adopt item number 1, page 18. All those in favor? Opposed? Motion approved.
Turning to page 19 of the white packet, under the Department of Health Administration, DLS recommends restricting funding pending the submission of a staffing and salary study, and the agency disagreed with the recommendation.
Senator Zucker.
I'd like to adopt with the modification of report requirements. And is there anything additional?
On page 10 of the blue packet.
Okay, can we walk through that just so I can?
Sure.
Is that
So,
okay, Mr. Chairman?
Yes, sir.
Okay.
so on page 10, the changes to the DLS recommendation were to instead request an update on recruitment and new positions at MDH. The department submitted the staffing and salary study that was overdue late. And so there's a couple changes to what is required to be included in the report. And one thing that was new is a detailed breakout of new positions and contractual conversions that are happening department-wide.
Good. I would move to adopt blue color page 10.
There's been a motion and a second to adopt with modification item number 1, page 19, also blue color page number 10. All those in favor? Color page 10. All those in favor? Opposed? Motion approved.
The second recommendation on page 20 of the white packet is to adopt committee narrative requesting a report on the overdose response efforts undertaken by the Department of Health. The department concurred in part, but instead requested that this information be included in their annual submission for the Commission on Behavioral Healthcare Treatment and Access. And there's a color page for consideration on page 8 of the blue packet. And it's reflecting that change.
I would move that we adopt color page 8, blue color page 8.
There's a motion, there's a second to adopt with modification item number 2, page 20, looking at blue color page number 8. All those in favor? Opposed? Motion approved.
There's additional narrative for consideration in the blue packet on page 9 for the Department of Health and the Office of the Secretary, requesting a report on the implementation of the recommendations of the recent audit finding.
There's a motion, there's a second to adopt blue color page number 9. All those in favor? Opposed? Motion approved.
On page 22 of the white packet, the DLS regarding the Office of the Healthcare Quality. DLS recommends to concur with the governor's allowance and the agency concurs.
Yeah.
It's been a motion, a second to adopt item number one, page 22. All those in favor? Opposed? Motion approved.
On page 23, regarding the health professional boards and commissions, the first recommendation is to add language restricting funds until a report is submitted regarding several boards' efforts to meet their complaint investigation goal. The agency did not provide a response.
Yeah.
There's been a motion, there's been a second to adopt item number one, page 23. All those in favor? All those opposed? Motion approved.
The second recommendation is to strike language that allows the Board of Nursing to receive reimbursable funds, since legislation last year transferred infrastructure operations to the Maryland Department of Health. The agency disagrees, since this reimbursable fund relationship is allowable under statute, and since infrastructure operations are existing and ongoing items, MDH prefers to budget these as reimbursable funds.
Move to reject.
There's been a motion, there's been a second to reject item number two on page 23, going on to page 24. All those in favor? Opposed? Motion approved.
There's also a color page on page 12 of the blue packet. This additional language requests a report on the details of the transfer of Board of Nursing infrastructure operations to MDH.
Move to adopt color page number 12.
There's been a motion, there's been a second to adopt blue color page number 12. All those in favor? Opposed? Motion approved.
On page 25 of the white packet, DLS is recommending that the committees restrict funding pending the submission of a report related to the local health departments. The agency concurred in part. They concurred with the report, but disagreed with the funding restriction. There have also been proposed modifications to the report requirements, which you can find on page 13 of the blue packet.
I would adopt with the modifications of color page number 13.
There's been a motion and a second to modify the adoption for item number one on page 25, going on to page 26, adopting blue color page number 13. All those in favor? Opposed? Motion approved.
On page 15 of your blue packet, there's an additional item, committee narrative, or excuse me, budget bill language, specifying, requesting a report related to the oversight of physician dispensing process.
There's been a motion, there's been a second to adopt blue color page number 15. All those in favor? Opposed? Motion approved.
Moving back to the decision document on page 27 under the Prevention and Health Promotion Administration. Items 1 and 2 are related, and they would reduce funding for the Center for Firearm Violence Prevention and Intervention by $8 million. The agency disagreed.
I would move to adopt with modified under reduced to 6 million.
There's been a motion and a second for items number 1 and number 2 on page 27 to adopt the modification to reduce to $6 million instead of 8. All those in favor? Opposed? Motion approved.
Item 3 on page 27, DLS recommends reducing $1 million from the Maryland Prenatal Infant Care Grant Program. That's due to underspending that was reported in fiscal 24. The agency disagreed.
Move to reject.
There's been a motion and a second to reject item number 3, page 27. All those in favor? Opposed? Motion approved.
And then item 4 on the bottom of that page, it would put in committee narrative requesting that performance measures related to adult use cannabis gets added into the managing for results submission that the agency provides every year. MDH disagreed and noted that it would take 1 year to get that baseline data needed to create this annual submission. And so there is an additional item on page 20 of the blue packet. And this would, instead of asking the committee narrative requesting that the data is provided in the managing for results submissions moving forward, it would instead ask for one report due November 1st on the possible data for that use.
There's been a motion, there's been a second to adopt with modification, item number 4 with blue color page number 20. All those in favor? Opposed? Motion approved.
Okay. So then staying in the blue packet, on page 17, under Prevention and Health Promotion Administration, this would be budget language restricting funds pending a report on the Maryland Pediatric Cancer Fund.
The second? Yep, there's a motion, there's a second to adopt blue color page number 17. All those in favor? Opposed? Motion approved.
Page 18, this is budget language that would restrict funds pending a report on performance monitoring of the Maryland Prenatal and Infant Care Grant Program.
There's been a motion, there's been a second to adopt blue color page 18. All those in favor? Opposed? Motion approved.
And then page 19 is committee narrative that would request a report on the efforts to fill long-term vacant positions in the Prevention and Health Promotion Administration.
There's been a motion, there's been a second to adopt blue color page number 19. All those in favor? Opposed? Motion approved.
And then page 21 in the blue packet, this is committee narrative that would request a report on the VIP Kids program and how it transitioned to local health department administration.
There's been a motion and a second to adopt blue color page number 21. All those in favor? Opposed? Motion approved.
On page 29 of the white packet, DLS recommended under the Behavioral Health Administration to restrict funding pending the submission of a report on the recoupment and forgiveness of overpayments to providers. The agency disagreed. There's an additional item on page 22 and 23 of the blue packet modifying this recommendation.
Needed to adopt and modify the restriction to $125,000 and modify the reporting requirements according to items 22.
There's been a motion and a second to modify the adoption for item number 1, page 29, supplementing it with blue color page number 22 and 23. All those in favor? Opposed? Motion approved.
Back to the white packet on page 30, DLS is recommending restricting funding. Restricting funding related to a report on provider reimbursement spending in 2 BHA programs. The agency disagreed.
There's been a motion and a second to adopt item number 2, page 30. All those in favor? Opposed? Motion approved.
On page 31, recommendation 3 is to strike from the budget bill language the term county grants related to funding for the assisted outpatient treatment grant programs to make that that funding contingent.
Second.
There's been a motion and a second to adopt item number 3, page 31. All those in favor? Opposed? Motion approved.
Recommendations 4, 6, 7, 8, and 9 on the following pages are all annual language under the Behavioral Health Administration, authorizing them to transfer funding from between behavioral health programs and also allowing them to transfer funding into QO103 in the Medicaid program to cover shortfalls in Medicaid. The agency concurred in part.
Move to adopt 4, 6, 7, and 8.
8 and
8.
There's been a motion, there's been a second to adopt 4, 6, 7, 8 and 9 on pages 31 through 34. All those in favor? Opposed? Motion approved.
Great. On page 32, another recommendation is to add language to oh, I'm so sorry. We're going to skip this one because this is related to the BRFA. There's an additional item in the blue packet on page 24 requesting committee narrative on long-term vacancies.
Move to adopt color page 24.
There's been a motion. There's been a second to adopt blue color page number 24 for long-term vacancies. All those in favor? Opposed? Motion approved.
On page 35, for the Developmental Disabilities Administration, the first recommendation adds language restricting funds pending pending a report on advanced payments to providers during their transition to LTSS. The agency concurred with the submission of the report, but requests that no funds be restricted.
There's been a motion. There's been a second to adopt number 1, page 35, item number 1, page 35. All those in favor? Opposed? Motion approved.
The second recommendation on page 36 adds language restricting funds pending a report on year-to-date spending in LTSS. The agency concurs with the submission of the report, but requests that no funds be restricted.
There's been a motion. There's been a second to adopt item number 2, page 36. All those in favor? Opposed? Motion approved.
On page 37, the last recommendation is annual language restricting funds for the Community Services Program to be used for that purpose only. The agency did not provide a response.
There's been a motion. There's been a second to adopt item number 3, page 37. All those in favor? Opposed? Motion approved.
Page 38 of the decision document begins the decisions related to the Medicaid, Medical Care Programs Administration. This first item is standard language that would restrict funds pending a report on the agency's repeat audit findings. MDH didn't provide a specific response.
There's been a motion. There's been a second to adopt item number 1. All those in favor on page 38. All those in favor? Opposed? Motion approved.
At the bottom of page 38 and continuing on to page 39, there is annual language that would restrict funds for the Medicaid provider reimbursements to that purpose only, although it could be transferred to the Maryland Children's Health Program if needed.
There's been a motion and a second to adopt item number 4, page 38, going on to page 39. All those in favor? Opposed? Motion approved.
Item 5 on page 39 is a committee narrative that would request reports on the community, or one report on the Community First Choice Program and HCBS spending and on the registry for the Community Options Waiver Program.
There's been a motion. There's been a second to adopt item number 5, page 39. All those in favor? Motion approved.
On page 40, and continuing on to page 41, item 6 is narrative that would request a report on quarterly reports on Medicaid enrollment changing after the unwinding period ends.
There's been a motion. There's been a second to adopt item number 6, page 40 on to 41. All those in favor? Opposed? Motion approved.
On page 42, item 7, this is a recommendation to reduce funding for the increase in health insurance costs that's budgeted under MDH. This was also centrally budgeted within the Department of Budget and Management. So this is a technical correction to fix the double budgeting issue.
There's been a motion. There's been a second to adopt item number 7, page 42. All those in favor? Opposed? Motion approved.
And then item 8 on that page is again, annual language that would restrict funds for the Maryland Children's Health Program to not be transferred out, except it could be transferred to the Medicaid reimbursements.
There's been a motion. There's been a second to adopt item number 8. All those in favor on page 42. All those in favor? Opposed? Motion approved.
So then turning to the blue additional items packet, beginning on page 25. This first item is committee narrative that would request a report on recruitment of anesthesiologists in Maryland.
There's been a motion, there's been a second to adopt color page number 25. All those in favor? Opposed? Motion approved.
Page 27, this is committee narrative that would request a report on reimbursement rates for maternal fetal medicine.
There's been a motion, there's been a second to adopt blue color page number 27. All those in favor? Opposed? Motion approved.
Page 28, this is committee narrative that would request a report on nursing home participation in Medicaid and reported revenues.
There's been a motion, there's been a second to adopt blue color page number 28. All those in favor? Opposed? Motion approved.
Page 29, this is committee narrative that would request a report on Medicaid reimbursement of school-based behavioral health services.
There's been a motion, there's been a second to adopt blue color page number 29. All those in favor? Opposed? Motion approved.
On page 30, this is committee narrative that would request a report on End the Wait initiatives to increase HCBS provider capacity.
There's been a motion, a second to adopt blue color page number 30. All those in favor? Opposed? Motion approved.
And on page 31, this is committee narrative that would request a report related to a federal final rule on HCBS or long-term care data reporting and would request information on HCBS providers and nursing homes.
There's been a motion and a second to adopt blue color page number 31. All those in favor? Opposed? Motion approved.
So then moving back to the decision document on page 43. Under the Health Regulatory Commissions, this first action would is committee narrative requesting an annual report on the evaluation of the Maryland Primary Care Program. The agency disagreed and said that MDH is already conducting an independent evaluation of that program. And so page 33 of the additional packet, the blue pages, this would be committee narrative requesting that evaluation be submitted to the budget committees.
There's been a motion, there's been a second to adopt with modification, item number 1, page 43, supplementing with blue color page number 33. All those in favor? Opposed? Motion approved.
And then item 2 at the bottom of page 43, continuing on to 44, this is committee narrative that would request a report on the community supports or on the grants being provided by the consortium on coordinated community supports, and the agency concurred.
There's been a motion and a second to adopt item number 2 on page 43, going on to page 44. All those in favor? Opposed? Motion approved.
And then on the additional page packet on page 32, this is a committee narrative that would request a report on private payer coverage of ambulatory surgical facilities.
There's been a motion, there's been a second to adopt blue color page number 32. All those in favor? Opposed? Motion approved.
So there's actually one additional item for your consideration. It's not in the packet. So I think, or maybe they already have it. Yeah, so it's a loose page. The header is the Health Regulatory Commissions. This is budget bill language that would restrict funds pending a report on the HSCRC's implementation of recommendations related to trauma center funding in the state.
There's been a motion, there's been a second to adopt loose color page number 1, dealing with the HSCRC. All those in favor? Opposed? Motion approved.
Thank you.
On page 45 in the white packet, for the DHS administration, DLS recommends adopt committee narrative, requesting a report providing information on the MD Things implementation status. The agency concurs.
There's been a motion, a second to adopt item number 1, page 45. All those in favor? Opposed? Motion.
There is an additional request in the blue packet on page 34. that request a report on the Department of Human Services Administration efforts to fill the 13 positions that have been vacant for more than a year.
There's been a motion, there's been a second to adopt blue color page number 34. All those in favor? Opposed? Motion approved.
The actions for the DHS Social Services Administration begin on page 46. Recommendation 1 is to restrict funding pending a report from the Office of Legislative Audits indicating that all pending repeat audit findings have been resolved.
There's been a motion and a second to adopt item number 1 on page 46. All those in favor? Opposed? Motion approved.
Recommendation 2 on page 47 and 48 is language restricting funding pending a report on Child Welfare League of America caseload to staffing ratios.
There's been a motion, there's been a second to adopt item number 2, page 47, going on to page 48. All those in favor? Opposed? Motion approved.
Recommendation number 3, beginning on page 49, is committee narrative requesting a report on hospital stay data and hospital overstay data.
There's been a motion and a second to adopt item number 3, page 49. All those in favor? Motion approved.
Recommendation number 4 on page 50 is committee narrative requesting a report on various provisions of the Federal Family First Prevention Services Act.
There's been a motion and a second to adopt item number 4, page 50. All those in favor? Opposed? Motion approved.
Recommendation number 5 on page 51 is annual budget bill language, which would restrict funding in the foster care maintenance program to that purpose.
There's been a motion and a second to adopt item number 5 on page 51. All those in favor? Opposed? Motion approved.
Recommendation number 6, beginning on the bottom of page 51 and continuing on to page 52, restricts all funding made for the purposes of rate reform and provider rate increases pending the receipt of a report on how those funds will be spent.
Move to adopt the modified restriction to 250,000.
There's been a motion and a second to modify the adoption of item number 6 on page 51 to 250,000. All those in favor? Opposed? Motion approved.
Recommendation number 7, starting on the bottom of page 52 and the top of page 53, is also annual budget bill language restricting funding in the Child Welfare Services Program to that purpose.
There's been a motion and a second to adopt item number 7 on pages 52 and 53. All those in favor? Opposed? Motion approved.
Recommendation number 8 on page 53 is to reduce the fiscal 2024 proposed general fund deficiency appropriation by $7 million.
There's been a motion and a second to adopt item number 8, page 53. All those in favor? Motion approved.
On page 54 in the white packet, for the DHS Child Support Administration, DLS recommends to adopt language reducing a total of 10.7 million, including 3.6 million in general funds and 7.1 million in federal funds in the child support state program in the Department of Human Services Child Support Administration. The agency disagrees.
There's been a motion and a second to adopt item number 1, page 54. All those in favor? Opposed? Motion approved.
The second recommendation is to adopt a committee narrative requesting a quarterly report on the child support performance, and the agency concurs.
There's been a motion and a second to adopt item number 2, pages 54, going on to page 55. All those in favor? Opposed? Motion approved.
On page 36 in the blue packet, there is an additional request, which is to adopt committee narrative requesting a report on the Department of Human Services Child Support Administration efforts to fill the 6 positions that have been vacant for more than 1 year.
There's been a motion and a second to adopt blue color page number 36. All those in favor? Opposed? Motion approved.
Turning to page 56, this begins the actions related to the Family Investment Administration. I'm actually going to start with recommendations 2 and 4 because recommendation 1 has a connection to them. So recommendations 2 on page 56 and 4 that begins on the bottom of page 57 would require the transfer of the $9 million in general funds and $9 million of federal funds that are for administrative expenses for the summer EBT program to the local family investment program to be used for the same purpose. The agency disagreed. Part of their disagreement was because the funds can be used for either state or local costs. So the second of the kind of single page items that it has the heading local department operations on the bottom of that page and then on the back of that page are replacements. I'm sorry, it was 2 and 5, not 2 and 4. Would modify the DLS recommendation to require the transfer to the director's office, which is the state headquarters. So this would be modifying recommendations 2 and 5 in the white decision document.
I would move to adopt the color page, local department operations that would substitute them to M number 5.
And then going back to recommendation 1, you would want to just look at the item there on the top of that page. So the original DLS recommendation was to restrict the funds for the assistance payments program to that purpose, but also to allow for transfers to the foster care maintenance program and child welfare services to replace TANF spending. And the original DLS recommendation was also to allow the funds to be transferred to the local family investment purpose program for the purposes of transferring the summer EBT program. So this would modify that to be consistent with the actions you took on 2 and 5.
So there's been a motion and a second to adopt with modifications number 2, 5, and number 1 with the blue loose sheet. All those in favor? Opposed? Motion approved.
Okay. So back to the main document, recommendation 3 on page 57 would reduce funding for the replacement benefits due to the spending that has actually occurred in the program by $7.5 million. The agency disagreed.
There's been a motion and a second to adopt item number 3, page 57. All those in favor? Opposed? Motion approved.
Recommendation 4 reduces 1.6 million of special funds. That would be the local match for the summer SNAP for children program. The department's budget doesn't include the general fund, so there wouldn't be a local match for the program. The agency disagreed.
There's been a motion and a second to adopt item number 4 on page 57. All those in favor? Opposed? Motion approved.
Recommendation 6 on page 58 reduces 200 million of federal funds in the SNAP program based on the lower estimated average benefits compared to what the budget was based on, and the agency concurred. Recommendation 7, beginning on the bottom of page 58 and continuing on to page 59, is annual narrative requesting quarterly reports on application processing, denial rates, and case closures.
Move to adopt.
There's been a motion to adopt items number 6, 7 on page 58, going on to page 59. All those in favor? Opposed? Motion approved.
On page 60 is the last recommendation in this agency. So this was narrative requesting information on the implementation of the summer EBT program, including participation. If you look at page 35 in the blue pages, this would modify the recommendation to add additional reporting related to the timing of benefit distribution.
Adopt color page 35.
There's been a motion and a second to adopt with modification items number 8 on page 60, supplement with page blue color page number 35. All those in favor? Opposed? Motion approved.
Actions for the DHS Office of Home Energy Programs begin on page 61. Recommendation number 1 is committee narrative requesting a report on energy assistance application processing times and denial rates, and the agency concurred.
It's been a motion and a second to adopt item number 1, page 61. All those in favor? Opposed? Motion approved.
Recommendation number 2 is committee narrative requesting a report on changes of eligibility for energy assistance programs. There is a slight modification of this item on page 37 of the blue packet, which would change the date of the reporting period of the data that's requested.
Move to modify by adopting color page 37.
There's been a motion and a second to adopt with modifications item number 2, page 62, and supplementing with blue color page number 37. All those in favor? Opposed? Motion approved.
Recommendation number 3 on the bottom of page 62 and turning to page 63 is committee narrative asking for a status update on the establishment of transition to a centralized administrative model for energy assistance benefit programs.
There's been a motion and a second to adopt item number 3 on page 62, going on to page 63. All those in favor? Opposed? Motion approved.
There is one last item under the additional page, the blue packet, page 38. This is committee narrative requesting a report on customer service metrics for energy assistance programs.
There's been a motion and a second to adopt blue color page number 38. All those in favor? Opposed? Motion approved.
Back in the white packet on the back page, page 64, for the Department of Housing and Community Development, DLS recommended deleting special funds for operating assistance grants that are double budgeted, and the agency concurred.
There's been a motion. There's been a second to adopt item number 1, page 64. All those in favor? Opposed? Motion approved. There's a motion. Here's a second to move the entire document of the bill. All those in favor? Opposed? Motion approved. Thank you all. This ends the hearings for HHS. Thank you again.